In recent weeks, you've heard that people with underlying conditions are most at risk for suffering complications if they contract the H1N1 virus. But what exactly are those underlying conditions? More than a dozen people have died in New Mexico due to the H1N1 virus or swine flu. Many people are fearful because it's new, it's an unknown strain that acts differently than seasonal flu.
As you all know, this virus seems to be a particular problem for the younger age group opposed to the usual seasonal, which is the very young and the older population.
Dr. Bob Bailey is the incident commander for UNM Hospital. He and other health officials say not to panic. The severe cases of H1N1 are usually found in patients with underlying medical conditions.
The children and adolescents 5 to 18 who have predisposing healthcare conditions that increase their risk of complications for flu. So for this brief initial period where the supply is lower, we'll be prioritizing accordingly.
Very young children and those individuals who have an existing chronic disease or other illness are at greater risk.
So what are these underlying conditions or pre-existing diseases? Health officials say they include asthma and other chronic lung diseases, chronic heart disease, and immunosuppressive disorders. And in children, the most common underlying conditions are asthma and chronic lung disease, neurological or neuromuscular diseases, and sickle cell or other blood disorders. Children and adults with these conditions will be the first to get the H1N1 vaccine during the initial period when the supply is low. Now, if you have mild flu-like symptoms, health officials say you should contact your primary care doctor. However, if you have severe symptoms, head straight to the emergency room.